Is it possible to have your practice 100% full with people who are happy with care and happy with their results? In essence, happy with you. I have so many doctors who tell me they get up in the morning and their stomach is in knots because they're so concerned about those people who are not coming along, those people who are not happy. And they tell me they just wish that everybody was happy and everybody was getting great results. I'm Dr. Russ Rosen. I help natural health care providers like you thrive in a care versus scare true optimal health model. Well, is it possible to have a practice 100% full of people who are happy, getting good results, love your care? The answer is yes, but it's not how you think. Many of us chiropractors have heard Jimmy Parker back in the day talk about the 80-10-10 rule. 80% of your patients are going to get better, 10% just a little bit better, and 10% they're just not going to get better. Many of us believe the solution to that problem is, well, I'll start to use nutrition, I'll start to use acupuncture, I'll start to use neuroemotional based techniques. But the reality is, the better you get, the more difficult cases you get. But we're never going to have a practice where 100% of the people coming in are getting better. If you are, I really want to know that. Really want to know that because I haven't found that to be true. So the truth of the matter is there is an 80-10-10 rule. Is it 10%? Who knows? For some it's less, for some it's more. But the reality is it's just the nature of the beast. The other one I heard is the bell curve. So 10% of the people are just going to have miracles. 10% of the people, they're just not going to get better. And 80% of the people are going to be getting better exactly as you expected. Again, it's just the nature of the beast. The challenge is so many of us focus on those few who are not happy, those few that are not getting results. Now, they might not be happy because they're literally not getting results. And that makes sense. I wouldn't be happy either. They might actually be getting the results that we expected, but they're just not happy. They think it should have happened faster. They wish that you would spend more time with them. They wish you would spend less time with them. They think it costs too much, but they're not happy. So we're just kind of, lump them into this group of people who are not happy. All right. So again, what happens is those unhappy patients can lead us to be unhappy. We can obsess over those people. We could see 100 people and they're all doing great. And one of them isn't, and that's the one that keeps us up at night. Okay, so what is the solution of this problem? The solution of the problem is to change the game, to reframe the process in your head. Here's how we do it. I want you to not only embrace the negative few patients who are not getting results, who are not happy, I want you to seek them out versus just having that dream. I wish my practice was full of people who loved me and were getting great results, et cetera, et cetera, et cetera. Now, I promise you we can get there. You just can't start there. So here's how we get there. Thinking that no one in your practice should be unhappy is a setup for failure. It's the nature of the beast. So quit thinking that. It's the nature of the beast. I need you to embrace the fact that there are going to be people that are either not getting results or are just not happy. Now, how do we fix it? So imagine, and I'm sure this is not true for you, but imagine 20% of your practice right now was not happy. Again, usually when I talk to docs, it's around 5 to 10%. But just for this conversation, imagine 20% of your patients are just not happy. Now, in our world, we in visit want to let them know my main goal is to make sure that you're in the right place to get the care that you need. And my promise is I'm going to help. If for any reason it feels like I can't help, I'll do everything in my power to get someone who can help you. But I don't want to waste your time and I don't want to waste your money. So literally what I would like you to do is I'd like you to make a list of all those people that when you see their name on the book, when you think of them, your stomach pangs. Okay, I want you to write them all down. And then I want you to speak with them, have a conversation with them. Say, do you remember when I said, assuming you did this, that my main goal was to make sure you were in the right place, that we only really wanted to work together if we're getting results? And if you haven't done that before, just bring it up. Just, hey, listen, I just really want to work with you for getting results. And I'm concerned, A, that you're not happy with care, or I'm concerned, B, that you're not progressing as we expected you would. And just ask them, are you concerned? Now, if the answer is yes, I too am concerned, clarify what the concern is, and if appropriate, refer them out. Now, obviously, by now, hopefully, you've spoken with them. They're eating well, exercising, dealing with stress, making their appointments. They're doing all the things that you would recommend for them to do. You're doing all the things that you would recommend. But if you're past that point and they say, yeah, I got to be honest, I really don't think things are coming along, or I got to be honest, I'm not really happy with care. And it's not something you can fix, i.e., I wish you would spend more time with me. I mean, that's something you can fix. But if it's something you can't fix, then please do what you said you would do and refer them out. Now, you can refer them out and they stay under care because you do chiropractic and you're referring them to a nutritionist. And now they're happy because they're getting that part taken care of and your role is clear and defined. Or not. You're just going to refer them out and they're not going to see you anymore. Either way about it, I don't care. I just need you to fix that problem of having people who are unhappy. That when you get up, you see their name in the schedule and that your stomach twists and knots and pains. That's what we need to get rid of. Now, the flip side is this. I promise you, I've had hundreds of doctors do this. Make a list, go talk to these people. You're going to find, I'll bet you, that around half of them will say, no, I'm not unhappy. Don't quit on me now. You're the only person who's ever helped me, right? Like you wanted them to get better this fast, and they're only getting better this fast, but they were doing this. So they're actually really happy, right? But the whole trick is to clarify the truth about where they're actually at. So imagine right now that you had 20 people out of 100 who were not happy. And now you got rid of that. They either left the practice or they're staying, but they're now happy. Do you now presently have a practice 100% full of people who are happy with your care? Yes. So does that 80-20 rule apply now? No, it doesn't, because I now have 100% of the people who are happy. That 80-20 rule will apply to my new patients coming in, and possibly some of them who've been under care that maybe later won't be happy. So my goal is to sniff those people out as soon as possible. And as soon as I notice a pang in my gut, instead of allowing that to grow and allowing myself to become uncomfortable and allowing my practice to fill back up with lots of people who are not happy, instead of that, I will immediately have a conversation with them. One of my favorite books is Loving What Is by Byron Katie. And she says, and I look forward to the next time I have a stomach pain. Why? Because I can do something about it. Once I recognize that, ooh, I had a stomach pain, they're not happy with care, or I'm concerned they're not happy with care, I can do something about it. So, can I have a practice full of people who love what I do, that are getting great results, that are happy? Yes, I can. I can't get there if that's where I start thinking that that's just how practice should be, because it's not the nature of the beast. I can get there if I go in, make a list of those people. I'm going to ask you to go ahead and do this. Make a list of those people, go have a conversation with them, either get them to stay because they're happy or get them to leave because they're not happy, and do what you can to find the right person for them. And then after that, I want you, like a bloodhound, to be sniffing out somebody who may not be happy. I'd much rather you say, hey, I'm getting a feeling maybe you're not happy with care. And I'd much rather them say, what are you talking about? I'm totally happy with care. Than for you to go week on end with you feeling uncomfortable. So if you do this, what I'd love you to do is come back and post, and I got to move this up, come back and post on here what your experience was. I'd love to hear that, and I can give you guidance along the way. So I hope you found that valuable. If so, please let other people know about this. If you have any questions, just go ahead and post or hit the email reply and let me know. I'll respond to you. If you would like to thrive in a care versus care true optimal health model, I can help you do it. Just get a hold of us. We can set up a time. We can chat down where you're at, where you want to get to, and how I might be able to help you get there. As always, much love and aloha. Bye, gang.